How have you actually managed to create the trust and transparency that's really essential for an effective partnership?
It starts with transparency. It starts with being very upfront and honest with your potential partners about what you're doing and why you're trying to do it. Each partner doesn't necessarily have to have the exact same desired outcome. Those desired outcomes and goals need to be aligned. And as long as they're aligned, there's opportunity to then say, okay, we have a set of aligned objectives here. Let's commit to working harder and working better, because through collective action, it's more effective and more efficient, and you'll have better outcomes because we can leverage each of our areas of expertise.
So if I think about what worked first, it can be quite a long process. So building the trust works, working together with that collaborator, understanding their problems prior to engaging with them. And I think that there's a buy-in. People want to have AMR comparable to other diseases. So there's a real, want to share that data to see what it looks like in their country as well, to make it local for them. And I think because policymakers will use this data locally, I think all of those are drivers to share the data.
One of the key components of this is ensuring that the local community has the ability to perform the analyses themselves and do the research themselves to support the data for action.
Data generation is one thing, but we actually need to see that data being used. And one of the gaps that we see is the ability to actually analyse and the availability of tools to do that. So I think for the SPIDAR project, Wellcome is definitely stepping in to provide some training there, and also to help both on the research capacity side, but also on the policy capacity side there. So the policymakers can actually look at this and understand what they're seeing and what they need to do with it.
I think we absolutely need to be thinking about ways in which we within industry and in partnership with governments can sustainably support long-term research and development to bring the antibiotics of need to the patient community. A new commercial model is needed. Certainly, I think government policymakers need to do that as well. But in our recognition within industry, we can't walk away from a commitment to stewardship and appropriate use. They need to be integrated and embedded together. Any conversation about access, research, and development needs to be linked to stewardship. And I think it's critical. Transparency comes from awareness, right? And being honest and upfront about what the data are. So I think first and foremost, we need to be transparent and honest through our awareness campaigns about what the risks are with AMR. There's only so much you can effectively communicate to the general public. So I think general awareness campaigns are a little bit different than a more focused advocacy campaign with government officials or public health officials. But I think certainly through awareness, you share information, you share data, and by sharing information, it only goes to expand transparency.
One of the first pillars within the Global Action Plan was actually awareness of AMR. I don't know that we're there yet in many countries. Yeah, I think we're still at the point of trying to make more people aware. The healthcare sector, yes, but reaching out from there. And I think it starts there. Have those conversations, have people understand what it is.
Yeah, and is there a role there for translating some of the fantastic research that we already have available, translating it more effectively into those messages that can then be understood more easily?
There's some fantastic social science work in this area, and we just need to integrate that a bit more with the data. And that's, I think, how we would move forward for action, really.
And I think we as a community need to do a better job with engaging with the broader patient community to expand their understanding about the role antibiotics play in supporting improved outcomes for their patients.
Data and evidence generation is crucial to underpinning context-specific action, but it does require effective translation into intervention and policy to be of value, and collaboration can be a key role in that translation. we do need to focus on collaborating across sectors, both public and private, and thinking who's going to be using the outputs and involving them in the partnership. So whether that be Ministry of Health or patients, they have a very key voice and should be at the table from the beginning.